I'm happily married to my wife of 42 years, Beth. We have three daughters. Leanne is the oldest, and then Randy's the middle child. She'll tell you the dreaded middle child, and then Lauren is the youngest. And we now have seven grandchildren. I run a business in Akron, Ohio. If you could look outside now, it looks like sunny California, but trust me, it doesn't feel that way at all. I manage my businesses. I manage money for people that are about to retire or retired to make sure they have enough for the rest of their lives and to leave a legacy to some institution or to some people. I had no symptoms of anything whatsoever. My doctor is also a dear friend of mine and who also happened to suffer from prostate cancer. So 2003 was when I had the first biopsy, and that biopsy was inconclusive. It said I did not have prostate cancer. Knowing what I know now, I left that doctor's office and there was no follow-up appointment of any kind. Now, my doctor, my primary care physician, being a person that had prostate cancer himself and was able to keep his numbers low, he may possibly should have been more alarmed about it and said, get back there every 6 months. But I was instructed by no one, and at that point didn't know enough about the disease to on my own say, get back in there every 6 months. The way that conversation in a perfect world should have gone is, Theo, your PSA is at 14. That's high. Okay. You are a candidate for getting prostate cancer. However, the success rate, if we find it early, is you basically get to live your life as if you never had it. And so, as scary as this sounds, Theo, I need you to come back every 3 months and do this so we can catch this and do something about it, and you can have a normal life. Normally, I guess there should be a 3-month or 6-month biopsy schedule. Nothing happened and I think I missed a couple of years of getting my annual exam from my doctor, my primary care physician. So it was then that I went to the primary care physician, and he said, your PSA is up in the 60s, 70s range.
Wow.
And you need to see a urologist. I thought two things. He'd always told me in my early 30s that I had an enlarged prostate. And so then in my mind, I said, well, maybe that could be part of the PSA issue. No one's being really urgent about it, me getting back in there after 2003. And so I was hoping, I said, maybe it's just a high PSA because of that. But of course, I was very nervous that it could be prostate cancer. So I went to the urologist. They did, and he got the results of the blood test. And he asked me a few questions. And he says, well, let's do another blood test in about 3 or 4 days. So we did another one, and my PSA rose again to around 14, I believe it was. Went from 12 to 14 very, very quickly. And they did the biopsy. When I sat in the urologist's office after my biopsy, he handed me a chart. He says, your Gleason score is 7. He goes, I want you to look at this chart. And he literally put his head down and wouldn't look at me. And I said, and I took the chart and I says, is this me right here? He says, yes. I said, so I'm at the high end of intermediate risk and the low end of high risk. Yes. And he says, and I says, and this is saying the average life expectancy is 11 years? He says, yes. I says, explain that to me. He says, well, 8 years will be great. 2 years, you'll be on hormones. Last year, you'll be miserable. Antonio, Leanne's son, was 5. The very first thing I thought is, Antonio is 5? Where will I be when he's 16? And I did the calculations and I said, I'll live long enough to see him turn 16 and get his driver's license. And if I make it that far, I'll be fine. So that was my first thought. Where will he be driving, and will I get to see him drive, and will I get to see him become a 16-year-old? Of course, we're beyond that now. And but that was my first thought when I calculated those numbers from that chart. And they did the biopsy, and I remember where I was and what I was doing when I got the phone call on a Saturday morning from my doctor at the Cleveland Clinic. And incidentally, my wife had been diagnosed with a melanoma the day before. And so we're in the car and I get the phone call and he says, Theo, it's prostate cancer. Let's set up a time to talk. And I want you to interview, me, the surgeon, talk to a radiologist, and determine a plan of action. And so I think it was the following week off to the doctor's office we went at the Cleveland Clinic, and that began the process of my prostate cancer journey. The surprising thing is neither one of us broke into tears right away. And we were at a stoplight actually when we received the information. And so we looked at each other and I think one of us says, what are the chances of both of us having cancer at the same time? Of course, we kept a conversation going and talked about what the next steps may be and that we had to call the girls. And I think we probably within the hour got home and went and sat in the library and started making the phone calls. And, they were naturally pretty devastated, and the ones that were close to home came over as quickly as they could. And then we just started plotting out when and what. They were all for surgery. My whole family was do the surgery. It's the only way to get it out. And I, quite frankly, was not interested in surgery at all. Wanted to do the radiation instead because it was less invasive. But at the end of the day, I never really had a peace about it. I felt that the only way they really could see what was going on would be to literally go in there and look. And so I opted for the surgery. I have a very good friend who in Chicago, who I called, who incidentally was also going through prostate cancer. And he says, I'm going to have you talk to my doctor. And this gentleman was retired. So he gave me a cell phone number and he was at his vacation home. And he picks up the phone and he says, all the treatments are pretty much the same success level. And he says, if I were you, I would strongly consider radiation. He says, because by the time you add up all the side effects, he goes, that one in your situation with your PSA number, he says, that's what you should do. And he says, I know the head of urology at the Cleveland Clinic. You want me to give him a call? I said, sure. So he calls him. And sure enough, he told me, he says, it'll probably be Tuesday before he calls you. He goes, today is Friday. I'll leave him a voicemail. He'll come in Monday. His life will be hectic. He'll call you Tuesday. Monday morning at 8 o'clock, my cell phone rings. Hi, I'm Dr. So-and-so, head of urology at the Cleveland Clinic. He says, I hear you know my friend, Dr. So-and-so. And I said, yes, I do. And he goes, my condolences to you. That's the first thing he says. I says, well, doctor, he told me that you said that radiation makes the most sense. He goes, no, he goes, I don't think so. He goes, I know I didn't really answer a lot of his questions. He goes, but I think here at the clinic, he says, you need to do surgery because if you do surgery and you have a relapse or reoccurrence, then we can do radiation. And he says, so we do a nerve sparing surgery so you don't have issues going down the road. And so once I heard that, I said, I don't know where this is going, but I'd rather have more than one shot at it.
Right.
If this is not going to go well.
Right.
And so that's what I did. I did the surgery. You're always concerned about your sex life going forward. And so a nerve sparing makes it more possible for, a man to maintain an erection, to have sex. And so, that's a big concern for a lot of guys. Now, I did have one of my buddies tell me, hey, at the end of the day, he says your wife may prefer just a lot of cuddling and you be alive. And, that was great advice. But Cleveland Clinic made sure to tell me, and that was also one of the discussions that I'd had with a second opinion doctor. He kind of felt like if you went with the radiation, then you would have less issues later, and it would not affect your sex life now. And so that was his reason for it. He says, if we're going to come up with the same success rate, then why impact your life in that way now? But then again, like I said before, for me, it was more important to do the surgery. And then the added bonus was when he said they could do the nerve sparing. I says, well, okay, then that makes it less of an issue. He just pretty much said this is going to be a pretty routine surgery. We will be using robotics that will help with less bleeding and a much quicker recovery. I am told that my father accosted him when he came out because the surgery ended up being about 6 to 7 hours. It was substantially longer than it should have been.
Wow.
And my father just was not too happy about that. So, but he told me the recovery would be 3 to 4 days and I'd be out of there. And he says, you'll have a catheter for several weeks. Come back and we'll take that out. He says, and you should be off and running. I think I ended up going 2 weeks longer than I should have, but I thought the catheter was great. You don't have to get up to go to the bathroom because you're sore after surgery. And so every time you try to lift yourself off of the chair, I mean, it's just painful. But he felt that the surgery would be pretty routine, very few complications, which ended up not being totally true, but you never know until you get in there. So I'm glad he did. And so things took a little longer. The surgery and the recovery, getting out of the hospital, took longer than normal. He always talked about the nerve sparing, and one of my seminal vesicles actually had cancer, so he had to remove that. And then the margins, when you do the surgery, you remove lymph nodes, and they usually do a few, and I think they ended up doing 10 or 11 removal of those, and that's what took the time. My issue was my creatinine levels were higher than they needed to be, and so they're worried about kidney function. And so it took a while to get those under control. My advice, if you're in a hospital, is you need to have your family kind of guard how often people come and go and really look out for you in terms of your rest and be able to delicately say, he's glad you came to see him, but he really needs to sleep right now. Because as you, I'm sure, know, you do not get any rest in the hospital. Every 3 to 4 hours, someone's coming to do something to you. And so therefore, you're the only time you get rest is when you get out of the hospital. Well, the issue with me was, they check your PSA after your surgery, and my PSA started to rise again. So that's evidence that you have a reoccurrence. We don't know how far. So they look at the surgery and said, well, then let's do an additional margin of X. And they feel they can go so far before they start affecting the lymph nodes. And once they affect the lymph nodes, then you have a whole different set of side effects. So the radiation itself was targeting a specific area, and with the idea of not having issues with your lymph nodes down the road. For prostate cancer, you just get on the table, they put a tarp over you, you pull your pants down to your knees, and you're on this flat bed, and the radiation machine just goes around. It actually tilts and goes around and hits specific areas that they've targeted and certain margins outside of where they think the prostate cancer may have spread to. And, you see the same 3 or 4 nurses, so you develop relationships with them. And that's really the process. You're done, and, you leave and go back to your life. Well, it was, hey, let's start the every 3 months and see where this goes. And then unfortunately, it went from 2 to 4 and from 4 to 6. And then they said, well, you're going to be dealing with this the rest of your life. So you need to talk to a medical oncologist. And so I did. And I went to his office, my wife and I, and he reared his chair back and put up his cowboy boots on the desk. And he says, do you know why you're here? And I says, yes, I have prostate cancer. My PSA is still climbing. He goes, do you understand that from now on, we're just, we're monitoring this, and that you are going to be dealing with this the rest of your life. And I reluctantly said, I do. And, he started out, he just wanted me to know the gravity of it. He goes, we're just going to be maintaining this for the rest of your life. And that's when it really hit me. When the doctor said, you got 8 good years, then you have 2 years of hormone treatments, your last year is miserable. That's when it hit me. I said, this really could be me. That's a case like a chronic disease. And he told me, what we would need to introduce when and what things they would use, and then went on through talking about clinical trials. And he says, so for now, we'll monitor it, and then that's what starts the CT scans, the bone scan once a year. And I had a bout with kidney cancer also, so I was getting the chest X-rays, and then all that ended up fine. So I've got to stop the chest X-ray. And so they removed it, and of course, the concern is if it returns, it could spread to the lungs. And so you have to do the scans that basically chest X-rays, because I was already getting a CT scan, so that kind of doubled for both the kidney issue and the prostate issue. So I had to get the X-rays in 5 years.
Right.
And that was done. So that was totally successful. I have not had a reoccurrence there. But I've had some cysts on my kidneys that I didn't know I had until then. And so they've watched them, and that's how they discovered it. It's crazy. They continued to climb until 2019. It got to 52. Since 2019, it has gone up and down, which is really strange. It sits at 57 now. So I called my doctor because I was supposed to have a bone scan in December. And I says, I don't see a bone scan on my charts. I says, shouldn't I be having a bone scan about now? He says, well, he goes, think about it. He goes, in 2019, your PSA was 52, and now it's 57. He says, percentage-wise, there's been very, very little movement. He says, I don't see any reason to do one right now. And there's a couple of philosophies, and his philosophy is if hormone treatments after metastasis do not prolong your life any more than taking hormone treatments before metastasis, why subject yourself to the side effects? And so that's what we've done. I have not started hormone treatments at all, and they have not found any metastasis at all. But I mean, nobody talks about it until you get it. And then all of a sudden out of the woodwork comes, well, I had prostate cancer 3 years ago. Well, I had prostate cancer 4 years ago. And you're walking around with all these guys, 3 out of 10 which have had it, and nobody knows anybody else has had it. So now, there's support groups, that type of thing. And not having it in my family, I was not that exposed to it. And then having a doctor that had prostate cancer that was doing okay and died in his 90s and not from prostate cancer. There just wasn't as big of a fear of it. But then once I got it and you start looking around, you're like, whoa, wait a minute, this is everywhere. Men of color men generally, but especially men of color, don't go to doctor. A lot of them don't. Some of it is because some of them don't have insurance. Some of them are macho. Some of them fear the doctor. They don't want a rectal exam. So I think getting out there, this is like getting your blood drawn. If you can do that, and you could start doing that when you're 40, it's going to save your life. And so I think the education process, and you've got to look at the hand of the government with the Tuskegee issues, saying, I don't know if I can trust. I mean, we're all interested in living as long as we can. And part of that is taking steps to assure that. And one of the easiest things you could do is just go get an annual physical. And when you get one, ask for a blood test to find out what your PSA is. And I don't care what number they give you, you want to know that number today more than you want to know that number tomorrow.